Stagnation of lung qi. Stagnation of lung qi impairs the descending of qi or downbearing of the qi. And so what happens is qi accumulates in the thorax. Cardinal symptoms: repressed sorrow. The patient would feel some constriction in the thorax, existential fears, shortness of breath. Dryness in the lungs. Dryness in the lungs is the initial stage of lung yin deficiency. Cardinal symptoms: dry cough, dry throat, itching in the throat. There is dry cough because the lungs are not moistened sufficiently. The voice is hoarse because the lungs do not moisten the throat sufficiently. The throat is dry because, again, the lungs don't moisten the throat sufficiently. Dry mouth, throat, and nose is due to the fact that there is impairment of the lungs' moistening function. Skin is dry because of impairment of lungs' moistening function. Wind cold in the lungs. In wind cold in the lungs, the defensive qi or wei qi of the lungs is fighting against the invasion of wind and cold pathogenic factors. Cardinal symptoms: acute cough with watery or white sputum, aversion to wind and cold, sneezing, feeling chilly, shivering. Wind heat in the lungs. In wind heat in the lungs, the defensive qi or wei qi is fighting against the invasion of wind and heat pathogenic factors. So wind heat in the lungs can be a reaction to wind cold in the lungs. Cardinal symptoms: acute cough with yellow sputum, aversion to wind and heat, infection with fever, sore throat. Phlegm, cold in the lungs. In phlegm cold in the lungs, dampness or phlegm and cold have invaded the lungs. It corresponds to excess pattern involving the spleen. Spleen is always involved in the development of dampness. Cardinal symptoms: cough with white viscous sputum, feeling of constriction in the thorax, aversion to cold, face edema with cold sensation, white tongue coating, sinusitis with white secretion. Phlegm heat in the lungs. Dampness and heat have invaded the lungs and are condensed into phlegm. This corresponds to an excess pattern involving the spleen. Spleen is always involved in dampness. Cardinal symptoms: cough with yellow viscous sputum, feeling of constriction in the thorax, aversion to heat, face edema with heat sensation, yellow tongue coating, sinusitis with yellow secretion.